Hello and welcome to our very first live chat for the People's Health Alliance of North America, where you can participate live in our live chat. If you head on over to YouTube and join us there. If you found us on Facebook, please join us on YouTube so you can participate in the conversation. My name is Jennifer Passvan. I'm one of the members of the admin team. I'm a holistic health practitioner, intuitive spiritual life coach, and energy healer. And I'd like one of the other admin team to chime in and introduce themselves.
Hello, everybody, and thank you so much for joining us this evening. My name is Denise Martinez, and I am one of the individuals that's a part of the admin team that is not providing any services and was just an interested United States citizen who had heard about the People's Health Alliance and wanted to learn more about it and see how I can take power in owning my healthcare, because that is what I am about. And the People's Health Alliance is about as well. So I joined back in the start of 2025 and have been with the org since then. Thank you.
Linda?
Hi, I'm Linda Boudelier-Gendron. I'm really happy that we can get together and have this chat tonight. I've been with the People's Health Alliance of North America since the very beginning, which goes back to 2022, when I heard about it through Pam Gregory, who posted it on her YouTube interview and let us know that there were 3 women in the United Kingdom who had started something called the People's Health Alliance. I immediately felt drawn to it. I felt that it was about time, actually, that we started to really look at healthcare reform in the United States. I've been a healthcare practitioner for over 40 years as a social worker, working primarily in mental health and doing a lot of work with trauma with children and adults. I have felt for a very long time that the United States healthcare system was not going in the direction that I thought would be the best for everyone. And so I was thrilled to find out that there were people who were starting a grassroots movement, because I really think a grassroots movement is the way to make these changes from the bottom up, not from the top down. I just don't think the top down is ready to do that. So thank you so much for joining us tonight.
Jordan?
Yes, my name is Jordan Maxwell. I'm a practitioner of acupuncture and Chinese medicine, which I have my doctorate in, and doctorate in chiropractic. Becoming new to the field of being an active practitioner, I have seen a lot of things that Linda has seen in my short couple of years of practicing. I have been a huge advocate, kind of like Denise even stated, of taking responsibility of my own health. And I think that the PHA has been a great advocate for supporting people in doing that. I'm super excited to be here, and thank everyone for coming by.
And Christine?
Hi, everybody. I'm Christine Clark. Excited to be here for this chat this evening. I was in healthcare, revenue, cycle, finance for hospitals, mainly in health systems, for over 30 years, and have seen the inside of a system that, as Linda mentioned, really could be changed. And I think those of us who have been working in it and have seen firsthand can be some of the people that might be able to help with that. I've been with the People's Health Alliance of North America for just shy of a year, and I'm excited about what everyone else was saying, people being able to find ways to take care of their own health and also advancing new ways for people to be looking at healthcare.
Mm-hmm. All right, so I know today one of the things we wanted to tackle was our healthcare systems in the US, Canada, and Mexico, and what their biggest issues are, what we can learn from them, and all that kind of stuff. Was there anyone that really wanted to start that conversation off?
Yeah, I'll just start it off because I actually looked into this, since I'm mildly familiar with the differences between the 3, but just to get everyone up to speed, I did do a little blurb to tell us the differences. So Canada does have universal coverage, and that's all funded through taxes. Mexico is building towards a universal coverage system like that. However, it's going to be more so something that's funded by the government and is eventually going to turn into a universal system. So they're kind of in a transitional phase right now. Their healthcare is no longer going to follow their employment or job, so you will get it no matter what. So universal-esque, but not fully there. And of course, we know in the U.S. here, we have no true universal coverage. And for the most part, your access does follow your job or the money. So.
And what a way to have access to healthcare, right?
Yeah.
So ridiculous. And if you want to have access to alternative types of healthcare utilizing our current healthcare system here in the US, you're pretty much, not allowed to do that because those practitioners are not even in the PPO plans or in their HMO plans that they offer. It's a shame.
Right. And it's not an equal system, because as a social worker, I work with a lot of clients who do not have employment and haven't had employment for a very long time. It's not an equal system. One of the things that I've struggled with quite a bit is the fact that we have to go through health insurance companies to get reimbursed as providers. And sometimes it would be better if we were able to provide the services without having to do that, but especially for the people who are not employed and don't have resources, financial resources. We need to be in the insurance system in order to protect them, because the only way that they're going to get treatment is if they can use their public health, which is usually a lesser plan than the plan that people have who are employed, but it's better than nothing.
Yep.
Yeah, and I think that that's where the huge conundrum comes, is the entire insurance game, for lack of a better word, especially being a new provider and having to learn that and still feel like I understand 5% of it. So if I only understand 5% of it, I can imagine what the lay public understanding basis is. And this is another fact I kind of looked into before coming on, was that, I think the exact fact was 1/4 to $500 billion is spent a year just on the administrative paperwork ins and outs of dealing with insurance. And it's like, the fact that I don't want to say it's completely being wasted, but mostly wasting money on a system that doesn't even actually need to exist for healthcare to be delivered is really frustrating, when I feel like these conversations are always arguments about money and being able to afford it, and for the government being able to fund it. And it's like, the money is clearly there and present. Its allocation seems to be the issue. So I think that's where I think most of our frustrations are coming from now, that it doesn't actually seem to be a money issue.
Mm-hmm.
Yeah, and I would argue that the system of using insurance companies to determine what kind of treatment is going to be reimbursed is not healthcare. It's medical care. It's based on diagnosis and symptoms, and we have to prove that the care is medically necessary, which is a very amorphous term that isn't easy to define. So it's not really healthcare. It's medical care that's being reimbursed by the insurance companies, but they're not really looking at how to keep people healthy. That's not really how the system works.
Mm-hmm. It's more like, what are they willing to pay for?
Yeah, well, one of the things that we've struggled with in mental health, which is I've spent most of my time as a practitioner helping people with their emotional and mental health. At one point, the insurance companies didn't realize that they were going to need to cover mental health. They actually thought that they could cover physical health, and that emotional health, mental health coverage would be an add-on that would be severely limited. I mean, at one point it was 12 sessions a year that people were going to be covered for, which ran out pretty quick for people who had serious mental health issues. So by the end of the year, they didn't have any coverage at all. And fortunately, there were some people in the Congress who decided that that was not okay. And at least 20, 25 years ago, they corrected that and said, no, if you're going to be an insurance carrier that covers healthcare, you have to be able to reimburse for both mental health and physical health. But there's still a bias against physical health. There's still a bias towards physical health.
Which I think is the more frustrating aspect, seeing that, especially from a more holistic provider, is that clearly if the mental, emotional health and some of these preventative alternative health things were covered and inclusive, the insurance company actually, in the grand scheme of things, might actually save money by covering their alternative and mental health, because as we know, both of those are leading to a lot of the physical health problems. I know me, as in my chiropractic education, the current stats say that like low back pain is even now medically understood to be sometimes a mental emotional condition. Like we're even starting to understand that these things do lead to, psychosomatic things. And so it's frustrating that we have now accepted that in the medical paradigm that they cause those issues, or that's still not being reflected in the way we, pay out for care or how things are actually operating, I guess.
Yep.
Well, let's be honest. The insurance company is not interested in saving money. They're interested in making money. So, if they can continue to charge for erroneous things and upcharge things, why not? It's why we're in the situation that we're in now, in all honesty, because our government is not vested in healthcare in the way that they should be. Right. In my opinion, because of the fact that, as has been seen for many years, there's more money going into the government system to make decisions go in the favor of the pharmaceutical companies or managed care than actually helping the people that it's supposed to serve. And this is across the board and everything, but we're only speaking about health here. So,
right.
Let's stick to the facts. And I mean, Christine, what's your perspective on it?
I was just going to ask.
Yeah.
I think another piece of the puzzle, I agree with everything that you're saying. Another piece of the puzzle that we can throw into this is the regulatory burden that gets put on top of everything, on top of healthcare providers and on top of insurance companies. And what I've seen happen is the federal government will pass some type of regulation, no surprise billing, which a lot of people don't understand. And that becomes a cumbersome piece that has to happen. And then a state will decide that they're going to pass something around surprise billing at the same time, but it'll be different than what the federal government is requesting. So then you have two agencies that are crossing each other, but the healthcare institutions still have to be compliant with everything that's happening. So that burden just is increasing more and more cost for the organizations that are providing care. So it starts from so many different directions of how broken things are. And the money, I'm not going to lie, I'll agree with Denise 100%. They're in it to make money. I mean, it's very sad that that's become, but it's kind of part of our capitalist society at this point that needs to change as well.
Yeah. Well, I think that's our biggest catch-22 right now, too, is because, I mean, say what you will about government, whether you like our current government or not, there is some skepticism with how things have been handled that, of course, we want this solution to be maybe universal healthcare or, some form of healthcare that is best for all. But that, of course, means that the government has to get involved, who are already saying we don't trust it, don't want them involved. So it's like, it really does make it hard of what the solution then therefore is, because as Christina was kind of saying, when they do get involved with their regulatory things, it's causing more problems. So do we even trust them to find solutions within a universal system? And I think these are all hypotheticals that I don't think any of us know the answer to, but I think that's what complicates things.
Yeah. And I think, it would take a lot of different things being moved around, because we would first have to make sure that the pharmaceutical companies and insurance companies can't lobby the government in order to get what they want. Like, there can't be mass financial lobbying. I think if I wanted to go to the government and lobby, that's fair, but I'm not giving them a ton of my money to do what I want. And so I think that has to be eliminated so that they can't sway any decisions. And I think we'd have to figure out how to either, do we eliminate the insurance companies and have those people just find other jobs? Because I think a lot of people would start screaming about, well, what would these people do? What would their job be? Well, probably ultimately work for the government, because the government would then be absorbing that management aspect of healthcare. But I think also, the U.S., like you were just saying, Jordan, our government, pick an administration, they're all, let's just be super honest, corrupt as all get out. And so, can we really trust the federal government to run the healthcare of the entire country? And do we trust them to do it well and without corruption? Not really. I feel like at least one of the ideas that I have is to kind of, because this country is so big relative to, say, where you do find universal health care, the populations are usually smaller and they're easier to manage. And I'm not sure if Canada has like universal health care, but then each province kind of runs their section, or how that's done. But my idea was, have universal health care, have the federal government fund it, but each state manage their own state-run healthcare that would be accepted in all of the other states, so that the states doing the management aspect, because then you're not trying to manage one whole massive country with billions of people.
Yeah, and what I've seen as I've gotten involved with the People's Health Alliance and talked to people in both Canada and Europe, especially the United Kingdom, is that the universal health care is not satisfactory either. It actually, in some ways, the United Kingdom is wanting to move towards more private care so that they have more choices. Mm-hmm. They're feeling like they don't have choices either. We don't feel like we have choices because of our system. They don't feel like they have choices either about what kind of care they can decide they'd like to try for whatever the issue is they're needing help with. Mm-hmm. And the other thing I want to say is that the providers are stretched to the limit. I would say probably on at least a monthly basis, I think about quitting the whole thing, because it's just so stressful. I wasn't aware until I went to the Insurance Commission in Rhode Island, where I live, and said, I need help dealing with this insurance company because they're not paying me. I'm providing services, but I'm not getting paid for the services that I'm providing. Mm-hmm. I need help. And they were very empathic and sorry to hear that, but said the only way that we can sanction the insurance companies is to have the legislative body in Rhode Island pass a law telling the insurance companies what they can and can't do in Rhode Island, which is really cumbersome. Yeah. But the insurance companies aren't actually accountable to the insurance commissioner in each state. I didn't realize that until I tried to access that. And so providers are stretched to the limit. And I just recently went for a physical to my provider that I've worked with for at least 20 years. And she said, I can't take it anymore. I'm out.
And is it the insurance companies for your provider as well that's causing her to?
Actually, no, it's more what Christine was talking about. It's all the regulatory stuff. I mean, the insurance companies are part of that because they're providing some of the regulation, but it's the way that the system is working. She said that new practitioners that are coming along are completely overwhelmed. They're not getting the training they need to be able to deal with what they're expected to deal with. A lot of times, another problem, I think, is that the healthcare in the United States is not individualized because there's all these protocols that the practitioners have to follow, which in many cases they don't even have the time to follow because they're given like 15 minutes to follow a protocol. So then it ends up being urgent care, basically. It's like triage. It's like they're just doing urgent care. They're trying in 15 minutes to figure out what's the most pressing problem that this patient has right now, and how am I going to address that? And so a lot of times it's through a pharmaceutical, but there's not an individualized system at all, which is when we look at alternative care, it tends to want to look at root cause of the problem, which is very individualized. It tends to want to look at all the different factors that may be contributing to the symptoms, be they environmental, social, emotional, the treatment plan needs to be individualized, but there's no way to do that in our system right now.
Yeah.
It's a complete overhaul of all of the systems is what's needed. And, that's something that we constantly talk about, because at the end of the day, the system is not benefiting anybody that's involved in it. The people receiving the care, the practitioners providing the care, the insurance companies, the regulatory, nobody is able to do their job in the way in which benefits them in any way, shape, or form. And at the end of the day, like you just spoke about, Linda, and Jordan had even mentioned before, it goes back to the point that, we have to take ownership of our health, and we need to approach health in a completely different way. And in the recorded history that we have, there's really not too much information with regards to a healthcare system that existed that catered to that, other than natural healthcare systems, or before organized healthcare was brought into play. And at the end of the day, that's really what we need to empower people to focus on, because these systems are not helping us in any way, shape, or form.
Mm-hmm.
Yeah, and I think to Linda's point about, there's many people who have universal health care are complaining just as much as we are as the United States, is it does show that it kind of goes back to the same problem that any type of healthcare that seems to be delivered by our governments, whether universal or not, seems to be an issue. So it does seem like, by definition of the PHA, we need to go back to grassroots, community-based things and things along those lines. And being a practitioner of Chinese medicine, it's kind of the hardest thing to tell somebody when I tell you what Chinese medicine is, or Vedic medicine, or any of these traditions, is they're actually not even medicines. They're simply, the way that these cultures lived and evolved because they needed those evolutions in order to keep themselves healthy. So, all of us have indigenous roots no matter where we come from, of people utilizing herb, people utilizing food therapy, using your spirituality to heal. They were just such a cultural practice for so long. And I think we've all been so removed from culture, from no matter what culture you come from, that those traditions have been lost. And I think that's the thing that we're trying to say we need to get back to, is that health has to be the culture instead of a system, if that is vibing.
Yeah. Well, and
totally
yeah. And one of the, I think, biggest barriers of that is that it's been intentionally made taboo to, talk about herbs, to talk about spirituality, to talk about energy healing, to talk about, any of these, what I would say is traditional medicine, which is technically what traditional medicine is all of these indigenous things. But those have been rendered taboo intentionally. Yeah. So, and I think it's, it kind of goes back to when doctors used to be trained in not entirely nutrition, but more herbalism and that sort of thing, way back, 16, 17, even early 1800s, it was much more well-rounded. And that was when the doctor would make house calls and give you personal recommendations. But there weren't insurance companies back then. So the doctor would pay so much of a rate, and you pay the doctor, and they were relatively affordable unless you were, really poor. And then that all got changed, and we don't need to go down that rabbit hole, as much of a fun rabbit hole as that is, just to save time. And then it got focused on, let's synthesize all of these herbs into drugs that we can sell. And then we'll take all of that education out of teaching doctors how to do healthcare, and instead teach them how to use the medication that we've synthesized from the herbs, but are now mass producing. And it just has snowballed from there. And so there would have to be quite literally an overhaul of the pharmaceutical companies and their ability to lobby, not just the government, but also give money to medical schools and fund medical schools and donate to medical schools so that teaching stays out of schools. So there are so many facets that need to be overhauled in order to get back to that more person-oriented medical care, as well as, what would you call that? Concierge doctors kind of being able to go to the patient, spend as much time as they need to, and not charge, $3,000 a pop, and be able to say, instead of, take this drug for $1 million, just take this herb that drug was made from, and here's how you make it, and put on this poultice, and go see that acupuncturist. And if the doctor could be given more freedom to not only learn these things, but also suggest these things and perform these things, that would be super helpful.
Yeah.
Oh, yeah.
I think for those of us that have the luxury of not using our insurance, because I have insurance, but it's just it's emergency care. It's not my go-to for staying healthy. Those of us who have the luxury of being able to go to homeopathic practitioners and Chinese medicine practitioners and herbal practitioners, naturopaths, and people who know about food as medicine and supplements. And, that's how I stay healthy. That's how I actually take care of myself at this point. And how do we form community groups that allow that access to everyone, so that it's not based on how much money you have, but what the need is, and that the community will find a way to meet that need.
Well, it's groups like us for sure that, really do feed that need and start to have the conversation and create the pathways for individuals and communities to create those opportunities. But in addition to that, I kind of want to challenge what you said, Linda, because we all have the capability to access all of these alternative medicines. It's just the fact that so many of us do not even think of that because of the fact that we're so, into this healthcare system. And I speak for myself primarily because when I learned about naturopaths and, Ayurveda, I started looking into it. And I did learn that my insurance didn't cover it, but I still sought it out. I found out what the costs were. They weren't astronomical. Somebody who may not be employed may have a challenge to seek out those services, but there are resources out there that can help people out to seek out those services. And through my naturopath, I was connected to a doctor that was within the healthcare system, and they worked together to provide me the healthcare that I needed. But I took the active path in researching and doing that, and knowing that I had the right to do that. I knew that I could see other doctors. It wasn't just like I have to see who they tell me. And that is something that people really do have to take ownership. And that's even when it comes to you're provided a diagnosis. That's not it. Go get a second opinion, because what one person tells you is not the end all. We're so conditioned to think that what we're provided is what it is, and it's not. Like Jennifer said, going back to the times where the doctors used to come to your door and used to know you and provide healthcare that was really individualized, that was because that's what it was. We don't know. We hear about those things, but we're so ingrained in this system that we don't know anything different. But we are the pathway to people knowing that there is a different way. In addition to magazines like Natural Awakenings and, the doctors that are a part of those magazines, the practitioners are out there. There are many Jordans out there. There are many Lindas out there that do not participate entirely in that system and are providing services to individuals. But you have to take your rights back. You really do.
Yeah, and I think that actually all of this conversation is kind of having me conclude that, as if I didn't already know the answer to this, is that, you know, the answer isn't going to be an institution or government solving this problem for us and giving us healthcare that we want or need. That sounds like such a great wish, but I think that wish is no longer going to be answered. So I think the answer is, you know, really creating these things outside of the system. You know, that's kind of the only option we have at this point. And I actually feel like with a lot of institutionalized things that government controls all across the board beyond healthcare, we have to just start creating smaller things outside of those systems, because not only are those systems falling and failing right now, they're not serving us, and utilizing that framework and utilizing those systems clearly just isn't working. So something like the PHA and a lot of offshoots from us is that I think that is our kind of our ultimate goal, to have something that exists outside of the system, because working within it really isn't all that helpful or cohesive right now. But I do feel like we're obviously in this time of just like this weird in between where like the system still exists, but it's falling, and this is here, but it's not yet. It's like we're in this very liminal space that it's like, it's very frustrating to be in, because you kind of want more stuff here and less stuff there. And I think we almost just have to be patient and kind of wait ourselves through and see what paths can illuminate to make this better. But I think we're doing all the work that we can for the meantime.
Yeah, I think the community outreach and forming communities with different practitioners, including allopathic practitioners, is important. I think especially trying to get allopathic practitioners on board so that there can be a team created, so to speak, almost like creating health teams. Because what I would love to see is for allopathic practitioners to not feel like they have to live within the taboo of anything that's considered alternative medicine is just, conspiracy, pseudoscience, blah, 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 whatever you want to call it, but rather start taking it more seriously and be able to say, hey, I'll work on this part, but you know what might also help you is acupuncture. I know a great acupuncturist. Why don't you go see an acupuncturist? And you know what? You could use, some help with some nutrition guidance. Why don't I recommend this nutritionist? And that's when you can start, we can all recommend each other to each other, including those allopathic practitioners, because I don't want there to be this divide between the alternative and the allopathic. I think we all could work as a team. We just have to find the allopathic practitioners that are open-minded enough. And I also think on top of creating that community, but I think also getting loud on social media to our local government, to our state government, to our federal government, getting loud on social media about it. I think our voices are going to become much more important. And also then, of course, our money is important and what we put our money towards. And, I think we need to expect a lot of pushback, particularly from those corporations, no, not corporations, those industries that benefit greatly from the system as it currently is. But I think the louder we get and the more, how shall I say, creative we get with regard to working outside the system, I think that's how we're going to move forward with it.
I think we're starting to see some of that. It's small, but I know in Colorado, I know at least 3 functional medicine providers just that are close to me that are certified allopathic physicians, but they bridge that back and forth, and they're looking at, would this medication be better for you, or would some type of a supplement serve you better? They're doing genetic testing. They're doing way more testing than anyone would get in a primary care office, so it costs a little bit more, but they figured out how to make it work. They're billing insurance for their time. They're selling their supplements, and they have additional modalities, nutrition being one of them, that they're referring to, and sometimes even other massage modalities or somatic work that I've seen. So it's there. it's figuring out how do we expand it and how do we get people excited about it. I mean, many people, I'm sure, well, I can't speak to this with experience, of course, but if you've gone to medical school for as long as you need to go to be able to be practicing medicine, you're probably going to practice what you were trained to practice, unless there's that additional education, as you were speaking of, Jennifer, a little bit, for them when they're getting their education to learn that there are other ways of doing things than the way they may be trained right now.
Yeah.
There are some medical schools that are finally starting to train doctors in other ways too. I live in Rhode Island. Brown University is the main educational institution here. The biggest one has taken over our healthcare system pretty much through their medical school and medical system. And they have an integrative path that physicians can take in order to learn about what the options are. So they have an integrative medicine department that allows physicians to be trained in the allopathic system while they're also being trained in the alternative system. Of course, they have to work a little harder because they have to take two tracks at once.
Mhm.
And then we've got medical schools like the one in Arkansas that Alice Walton started, that is allowing them to just stay in the alternative path as part of their education and not making it a two-track system.
Yes.
So it's starting to happen, and I have found practitioners who are open-minded and willing to refer me for chiropractic care, which then sometimes can get into nutrition and other ways of looking at problems. So as Denise said, it's finding the people who are open-minded, who are already there and really want to promote alternative integrative care. But, they can't do it necessarily themselves, but they're willing to refer you. And as a older person my insurance requires that anyone I see is referred by my primary care physician. So I need a primary care physician who's going to be willing to make those referrals.
Mm-hmm.
Well, Linda, and this is something I was going to ask you, and it actually is dovetailing what you just said there. I think another limitation of allopathic providers going down that path is the limitation of being a licensed provider. Even me being a licensed provider in acupuncture and chiropractic, which I have a lot more openness, a lot more wiggle room for what I can and cannot do. Being a licensed provider, though, has its limitations because you're worried about if you go a little bit too far this way, is the board going to say something like this? And I think allopathic medicine, more than my disciplines, I think people have that fear a little bit more. I don't know how much the hammer is coming down on them in these times. I don't know the answer to that. But would you definitely say, Linda, even in what you do, that like your license and your credentials actually are your limitations sometimes?
Yes, absolutely. And as a experienced provider, I've learned how to use what I know to keep my patients healthy, which is the criteria that the insurance company looks at in terms of payment, because although they're not necessarily trying to save us money, they are trying to save themselves money. And they don't want people to be hospitalized very often. They don't want people to need very, very expensive long-term care. So those of us who are experienced providers and know how to keep our patients healthy are able to work with the system to get the insurance companies to reimburse us. But yeah, the insurance licenses, the professional licenses have become like straitjackets in many cases, and people are leaving the allopathic system and calling themselves health coaches and saying, I'm trained as a social worker, I'm trained as an MD, I'm trained as a chiropractor, but I'm not going to be practicing in that system anymore because it's too restrictive. And so I'm calling myself a health coach so that I don't get accused of practicing without a license, because I don't have a license, because I don't want one anymore.
Yeah, I was actually going to say that same thing, Linda, that even mental health care providers are now calling themselves life coaches. in order to skirt around that, and they're not renewing their license in order to not kind of have to function within those constraints. And I think it's unfortunate that they have to feel like they have to do that. But I'm glad that there are those ways around it for them. And Christine, to kind of go back to what you were talking about you are seeing more allopathic practitioners get that extra training. You're right. I have seen a lot of, and I see it a lot on YouTube, and I think it's great where MDs and DOs are getting like functional medicine training, and it's not expensive and it's easy to add on to what they're already doing. And they do that extra testing, and it ties into nutrition and that sort of thing. And I feel like, and YouTube in a lot of ways, as much as YouTube can be not a good thing, I feel like a lot of it has come from YouTube, where you see more and more doctors branching out into that more functional medicine realm.
Absolutely. Yeah, I've seen a lot of that too. Cardiologists, and specifically, you're starting to see a lot of that on YouTube.
Yes.
Interesting. I think it's great, though, that the doctors and professionals are taking that ownership of their capacity to treat people and doing it in a way that serves them and serves the people that they're serving. Because if you're able to do it and not, subject yourself to the requirements of a licensing board, which in itself is, part of a system that has its own regulations and what have you, why not? And that's, some people may be like, oh, I don't want to go to a health coach, but it's that idea of getting informed and, do your research, use your discernment. Don't just be dissuaded by the fact that they have a term of life coach on their page or health coach, and you're like, oh, I've never heard of that. What's that nonsense? Mm-hmm. Things evolve, and healthcare is evolving as well. And with that, we have to keep up with that as individuals and as practitioners. So, I think that's phenomenal.
Yeah, I mean, because at the end of the day, I mean, no matter the license or title, you should probably know the person you're seeing if you have the choice anyhow, because there's many people who have great titles who are doing terrible work. I say that all the time when someone says to me, oh, I've seen acupuncturists before, and not to like dog on my own profession, but it's like, yeah, but that doesn't mean anything to me. It could have been a bad acupuncturist. There's bad acupuncturists. There's bad MDs. There's bad social workers. There's bad everything out there, So that shouldn't be the end all be all, the title of what you are seeing. And I think this is actually a perfect segue, and I didn't intend it to be this way, but it's what my brain's already thinking about is, we're talking about the evolution of healthcare and where all these things are going to go and how do we implement this. And I personally actually utilize AI in practice. I personally see it involving us in exactly. I see it involving us in the proper way. And my first disclaimer, because I think anytime anyone talks about AI, this is the comment you're going to get, and this is what we're going to talk about, is of course energy usage, water usage, environmental concerns. And I hear you. I think that that's something that we need to address. I think that that is a problem that's ultimately creating. But at the end of the day, it's a technology that's not going away. So instead of saying, well, you're just wasting water, this isn't going to be effective in the future, I think that conversation needs to be shifted to, how do we find environmentally friendly ways to continue to use AI then? Like, that's where the conversation should be going, instead of, oh, let's just not use it, which is very unrealistic at this point in our society. It's here to stay. So we need to find a way to use it in appropriate ways.
But the conversation about finding an environmentally safe way to use AI could attach to so many things that are already impacting our environment. It's going to be a tough sell, I think. I mean, just driving a car, or driving just one person in a car, not carpooling, all the things that are injuring Mother Earth. I get it. I hear you 100%, Jordan. I'm not pushing back on that. Yeah. But when you start talking about the environmental parts of it, so much to clean up there. And it kind of ties into what I was thinking as we're talking about these physicians, they're fighting against our culture in the United States. The standard American diet just by itself is something that, people don't know that going to McDonald's 5 times a week might not be the best thing for them. We're fighting against so many things with what's coming. There needs to be a big awakening. Maybe there will be.
Yeah.
There's a
maybe
big
there
awakening
is.
happening.
Yeah,
Yes.
You
But
know,
it all starts tying together, right? I mean, I didn't want to pick on that, Jordan, but as soon as we start talking about one of these modalities, it just branches out into everything else and so much of it is collapsing as we're seeing it happen around us.
Yeah,
So
I think
true.
we're starting to realize the interconnectedness of all these systems. Like we are talking about healthcare system right now, but we can't even get to one edge of it without being, well, that's government. Well, that's this, that's
Yeah.
that. Like, yeah, it is all the above. And to stay on the AI thread, it's like, it's a solution that comes with more problems, but that doesn't mean it's not a solution we shouldn't be utilizing and isn't probably going to help answer a lot more questions that we do have coming up.
Yeah, absolutely.
Well,
Yeah.
I just watched a really great interview on Diary of a CEO, and I forgive me because I don't recall the gal's name, but she used to work for tech companies and then she became an investigative reporter. And she does and she just wrote a book about the big AI companies and AI in general and all of the things that can become a huge problem with it. And I think obviously a mass surveillance control state, as well as complete decimation of the environment, is, on the negative side. But she pointed out that, with proper
Utilization.
sorry?
I was going to say utilization.
Well, utilization, but also proper mandates in order to kind of rein that stuff in, and prevent the misuse of, as well as the mass expansion beyond the point of necessity, where it's just expanding because they can. And, oh, hey, by the way, we're going to spy on you from satellites from space and, control, blah, blah, blah. But, she was talking about if we could focus more on smaller language models that do more specific jobs. So like if there could be smaller models for writing, for Ayurveda, for, she was talking about how there are small language models that are specifically looking for the proteins that a drug would impact in order to find how to create a targeted drug for a cancer that works on a specific protein. That can be quite benevolent. That can also be misused to create bioweapons to find specific proteins to attack. But again, there's always going to be the good with the bad. But instead of just all AI everywhere all the time, I think there does have to be some balance found, where we can't just let these big we can't let big tech just kind of come into our communities and create these big data centers that will utilize all of our aquifers and our groundwater and have, this constant humming noise in a neighborhood that doesn't, turn off, in order to have. I feel like those data centers are not for the way you and I use AI. I think that's for things that they're looking to roll out down the road. So I think there are ways that AI could be utilized and, how shall I say, and that they be powered in ways that are not going to be quite so detrimental as the current rollout.
Agreed. And I think a question, not to completely dovetail from you, that I'd like to actually throw to Linda, because I think this is something that comes up so much with this AI conversation, is its negative impact on mental health adjacent things.
Oh, I love this topic too.
Linda, I'm curious, have you seen more negative, more good, or are you somewhere in the middle as far as AI implementing and like with your current population?
Yeah, it's somewhere in the middle. I think that it provides access. I can't be available 24/7 for my clients. They have, panic episodes in the middle of the night and need someone to talk to, and it creates an avenue for them to feel heard and understood when they really need that. And that's helpful because there's a shortage of mental health providers. However, we have to be really careful about some mechanism of protecting the vulnerable. One of the things that I learned from my generation is that because we didn't grow up with technology, we were really not aware of what our children were doing with the technology and how that may or may not be detrimental, especially to their mental health.
Mm-hmm.
You know, it breaks my heart when I hear about young teenagers who have become suicidally depressed because of something that happened to them through their use of technology.
Mm-hmm.
And for people who have serious mental illnesses, which include thought disorders and the inability to discriminate what's good for them and what isn't good for them, we need to find a way to protect those people because they're vulnerable.
Yeah.
They don't always know the best ways to protect themselves. For my clients who are relatively high functioning and have, you know, relatively good self-esteem and discernment skills, I don't worry about when they're using ChatGPT when they can't talk to me to help them with a breakup or something that's going on in their life that they're really having a hard time coping with. I don't worry about that. But I do worry about the people who, and one of the things that the anxiety that we see in young people today is really off the charts. When I started out, it was not at the level that it's at now. And one of the things that contributed to that, unfortunately, was access to the technology. You know, for young girls, a lot of times they compare themselves to their peers online and don't even realize that what they're seeing isn't real.
Mm-hmm.
It's not even a real person that they're comparing themselves to.
Mm-hmm.
It's a filter. But they don't, you know, so how are we going to do a better job than my generation did at educating young people as they come along about the pitfalls of using technology in ways that might actually damage their mental health as opposed to support their mental health?
Yeah. It's sad that now ChatGPT psychosis is now like a word that's being like, that's what it's being called now. It has a name now, this psychosis that people can develop through using AI. And obviously I think they have to have some sort of either undiagnosed or maybe more mild form even, because I know someone who developed ChatGPT psychosis, and she does not have any mental illness, or at least has not been diagnosed with any. And you know, the way it worked was quite nefarious. But it was very terrifying to watch that and to kind of help her through getting out of that. But it's a thing, and I think I like that the Gen Z in particular is moving more towards more analog stuff. That makes me feel really good. Because boy, the millennials got really hit, Linda, I think in particular with seeing, you know, filters online and thinking I have to live up to that expectation while also scrolling for hours on TikTok and, you know, overstimulating their nervous systems. And then you add AI into the mix, and AI's blowing smoke up their butt. So they're relying more on talking to this AI that then turns, you know, kind of malevolent. And yeah, it's scary. It's really scary.
It definitely is scary, but it's a bigger issue than AI because it really did come about with the advent of technology starting to be in everybody's homes.
Mm-hmm.
And then when, you know, the mobile devices became more accessible to everybody, and all of the apps were on those mobile devices versus just the regular messaging and your games and your communication, it changed the whole dynamic. Because let's be honest, those complexes that girls had comparing themselves to others, you know, it exists. You go through that at a certain point in time in life. But you spoke about something, Linda, that is what it's about. It's discernment, number one. Number two, do they have a thought disorder that is already pre-existing? And Jennifer, your friend, even though it wasn't diagnosed, she may have something within her that could have led to that being the case for her. But it's, AI is a great tool, like Jordan mentioned, and it can help us in very many ways. But the downsides of it is something that, I mean, if we really want to talk about it, like Christine said, it's so entrenched in so many other things as well.
I think what you're trying to say, and I completely agree, is that like the downfalls of AI aren't the downfalls of AI. They're the downfalls of the society, the systems we have in place, like the already things that we have issues with, and it's actually pulling those issues out even more so. For instance, the ChatGPT psychosis. That's largely coming from we are incredibly sedentary and disconnected like society right now, that we don't have community, we don't have people to talk to, so people are going to AI. If we already had those things in place, would people be relying on AI right now? Probably not, but unfortunately we don't. And so again, AI, yes, is an issue, has its problems, has its pitfalls, but again, how all these things are turning out, it's really not the AI itself, it's these interconnected systems that need some serious healing.
I'm going to push back just a hair, Jordan, on that, because I do think it depends on the AI that you're using, because some AI don't tend to do that very sycophantic, smoke blowing, hyper praise to get you to want to use them more. That kind of codependent, or that narcissistic behavior where they, over flatter you, where other AI chatbots do that. And I find that it's the ones that don't do that more narcissistic, codependent, hyper flattery in the interim to kind of get you to want to rely on it more by reinforcing your emotional state and your mental state, that don't then lead to what we're calling ChatGPT psychosis. But it's the ones that do that target the people that do have diagnosed and undiagnosed mental health issues, but that also then, as well as just childhood wounds, like if you have the wounding and the mental state where you would be more prone to narcissistic and codependent abuse, you would be then more prone to relying on and wanting to use more those AI chatbots that do behave that way. And those were the ones that, as far as I can tell, that do then turn out to then be a little more.
I will concede to like the in between there, which I completely agree, is even in the ones that I think are a little bit more non-nefarious, is they still end most of your prompts with like a leading question and a way to like continue to engage. I mean, all the models are probably built on some financial incentive, because the more you activate them, the more that they do get kicked back. So I will say absolutely that with all these things, there needs to be more regulation. There definitely needs to be some vetting. There definitely needs to be something that we do, censor sometime in the future. However, I guess what I'm ultimately saying is there's also underlying issues probably also existing beyond the technology themselves.
Guaranteed. Absolutely. Yes.
But this is a great conversation, though, because the different AI agents and how they impact people is not even something that utilizing AI would even think about, because I use AI for one thing and one thing only. I wouldn't even talk to AI about my problem.
Oh, I have like 10 different ones, and I'm always constantly seeing which one's going to do this.
I do too. I do that too. And
they have their own personalities, and some of them are more nefarious than others.
Yes. And so I stopped using one in particular that I was like, it was the one that's known to cause the psychosis, but B, I saw how it behaved differently, and I was like, I'm not going to mess with that. But I do compare to what the other ones tell me, because I'm like, which one has the best information and is pulling from research, and which one is giving me, like, because you have to, kind of keep the reins tight on those guys. But we have to wrap it up just because we've gone about an hour. So we so appreciate those who have been watching live, and those who are going to be watching once this live ends. Don't forget to follow us on Facebook. You can join our Telegram group. Don't forget to like and share and subscribe to this channel so you can keep up on our news. Go to our website and sign up to our newsletter. But more importantly, join your community, join the PHA, and do what you can to help move healthcare forward in a way that is going to really benefit everyone. All right. Thanks, everyone, for joining.
Bye.
Bye.
Thank you.